Hi guys, it's your girl Lydiah Mpyisi once again, and today I'm here to talk about COVID-19 in children. And just so you know, this video is inspired by the Centers for Disease and Control and Dr. Thomas Moray of Yale University School of Medicine. All right, let's get started. So, do children get infected with coronavirus? Yes, indeed they do. The good news is they get a milder version of the symptoms, at least for now, but investigations are still underway. All right. So, what are some of the preventive measures that you need to take for your kids or to protect your children? The basic principle is all the basic hygiene practices that you would take for any adult, including frequent hand washing, keeping kids away from the sick, and let kids stay home if they're sick. Don't take them to daycare. And also, the most important thing is to disinfect all surfaces, including toys or frequently touched surfaces like kitchen counters, doorknobs, kitchen taps, everything, name it. You know your house better, so frequently used surfaces will need to be disinfected. All right. Should you keep your children home from school? Yes, you need to. We all know the COVID-19 is a respiratory illness, and given that this is also a respiratory season and kids are known to be reservoirs for respiratory diseases, please keep them home, especially if they're sick, and also separate them from the elderly so that we avoid transmitting this disease to the most vulnerable population in our nation. And right now, at least we know that schools are closed, so children can stay at home. Okay, so when should you call a doctor? You should call a doctor if you suspect exposure to the COVID-19. Maybe your kid had contact with someone who tested positive. We can also call your doctor if your kid is symptomatic for the COVID-19, and we are going to talk about the symptoms in a few seconds. And also, there's no need to call a doctor if your kid has minor symptoms. I know now parents are panicking and vigilant and being careful, monitoring their kids. But if your kid has minor symptoms like low-grade fever, just a mild cough, you can treat them with cough medication or Tylenol to lower their fever. And you can also give them ibuprofen if they're in pain, with frequent hydration like soup or fluids like water and juice. But of course, if your kid seems to be having an emergency, please call 911 and you'll be taken to the emergency room. Other than that, avoid the emergency room. And the problem with this is if your kid is not sick and you rush them to the emergency room, there's a higher chances that they will get infected with the disease. Or the other way around, if indeed they're sick and you take them to the emergency room, more so without calling, you risk the chance of your kid transmitting the diseases to other people. So if you can, avoid taking your kid to the emergency room, all right? So what are the differences between COVID-19 and influenza? And I'm going to focus on the symptoms. So the major symptoms of COVID-19 is a dry cough, fever, shortness of breath, and sometimes rhinorrhea, especially in kids. Rhinorrhea is a medical term that means running nose. So with influenza, the major symptoms are fever, usually above 100.5, extreme exhaustion, muscle or body aches. COVID-19 symptoms in children versus adults. It's almost similar, cough, fever, and shortness of breath, but it's still not yet known in kids who is at higher risk. And like I mentioned before, investigations are still ongoing, okay? And just to point out something, do not give your children masks if they don't need them. Let us save those masks for, the people who need it the most, the healthcare workers. Okay, so the key takeaways from my video today is children can indeed get infected with the coronavirus and suffer from COVID-19, the coronavirus disease. But so far, we know that they show less severe symptoms and some of them can recover. So it is very important to practice all the preventive measures that we've been told, including frequent hand washing and social distancing. Social distancing is very important. That's why schools are closed and employers are asking their employees to stay at home, okay? But above all, please be prepared for anything. Make sure you're up to date with what is happening so that you will know what to do in case somebody in your family is infected by the virus. And please do not panic. Everyone is at this. Our leaders are busy working. Our healthcare providers are on the front line trying to make sure that we are not at risk. So please follow what we are told by the officials. Other than that, it's always a pleasure to teach you, to share with you the little knowledge that I have. So thank you so much for watching this video, and let me know, comment down below what you think. If you disagree with me, if you agree with me, or if you have more suggestions, please comment below. If you find this video educative, like it, and please subscribe to my channel for more, educative videos. Other than that, have a wonderful day. Thank you. Bye.